Breaking news tonight, the coronavirus forcing millions more Americans into virtual lockdown. Over 75 million people in New York, California, Illinois, and Connecticut ordered to stay at home.
In light of the current shelter-in-place recommendations, CVRC will continue to provide support and be available by phone and email.
Ramona and Lori provided daily check-ins with Cliff and Arshan homes, FaceTime individuals and their care providers weekly, provided assistance in accessing medical specialists and therapies, followed up on hospitalizations, ensured all orders were carried out and all abnormal tests were reported, ensured staff's competency to provide care to those with complex medical needs, assisted providers with finding testing sites and obtain PPE, ensured homes had COVID protocols in place, reviewed protocols with a DDS nurse and participated in COVID-19 vaccination clinic. Rosie worked 7 days a week documenting and tracking COVID-19 cases for consumers, vendors, and CVRC staff. Over 2,100 COVID cases were tracked, reported COVID cases daily to DDS, ensured that all COVID SIRS were transmitted, reviewed all SIRS to ensure that they met reporting guidelines, began review process for COVID proposals, worked with our nurses to report urgent COVID cases that required immediate follow-up, organized weekly CVRC COVID meetings with Community Service Team, and shared COVID-19 cases with CCL weekly. Well, let's go back in time. Annette worked hard on delivering PPE to families that lived in the evacuation zones, reported to DDS daily in times of a disaster, tracked evacuations, met with DDS on CVRC's emergency operations, spoke with families whose house burned to the ground, worked on refining CVRC emergency operations plan, and assisted with vaccine clinics. Annette was the lead for traffic control for our vaccine clinics and kept everything organized.
CO and I established personal assistance services, service code 062, with our current ABA providers specifically to help caregivers help their kids to navigate online and remote learning during the COVID-19 pandemic. This included reaching out and collaborating with some of our ABA providers and creating agreements and parameters around the services for both providers and service coordinators. We also continued to conduct ABA reviews remotely to ensure that our families were still cared for within the scope of their ABA program. We worked with our ABA providers to help adjust and accommodate to the new environmental changes that the pandemic brought to the table and worked to ensure progress could still be made.
Stacy traveled to get PPE from Tulare County, searched throughout Fresno County for hand sanitizer, which was found at Napa Auto Parts, ordered bottles from Amazon and rebottled the hand sanitizer, about 400 plus bottles. Assist residential care providers in getting ADP staff cleared via CCL. Gathered PPE resources for care providers. Coordinated pickup distribution of PPE for CVRC catchment area. Coordinated transportation delivery of PPE to families and service providers. Organized drive-through PPE distribution. Tracked all PPE. Initiated batch of PPE OC addendums. Participated in vaccine clinics and sought out and vendor HHAs for staffing support. David assisted and supported Project Search when they were asked to leave the hospital in March, brainstormed with best buddies to advocate for their continued funding, recruited new FMS GD independents in order to resume the paid internship program, assisted with vendoring Game Gen, worked with Work for Good and CVTC on vendoring employment programs, and restarted the Fresno Local Partnership Agreement meetings. Allison assisted with the placement proposals, quarantine reviews, and delivered PPE to various facilities as needed. Nancy jumped on every opportunity to assist Stacy with PPE packaging and delivery and participated in various vaccine clinics. Tomorrow helped with follow-up SIRs from DDS. Tracked staff COVID cases. Called vendors on a weekly basis to see how our individuals and vendors were doing. Assisted with the family home agency audit. And assisted in many COVID vaccine clinics. LaToya assisted by making calls to our residential service providers on a weekly basis. The calls and the connection to resources were enough for them. They needed reassurance and support. They needed to know they were not doing this alone. Marissa and Ashley reviewed and tracked all COVID proposals, kept up to date with all CDC regulations. We were also part of the COVID task force, in which we would provide information on upcoming vaccine clinics in the catchment area. For a short period of time, we also assisted with follow-ups on SIRS, and were assigned lead roles for CVRC vaccine clinics. Well, let's take a look.
The Central Valley Regional Center helped provide the 400 COVID vaccines Monday.
We provide services for the intellectual and development disabilities.
At times, the clinic took on a celebratory atmosphere.
And this is a great segue for opening our programs and services so they can be in the community.
We immediately saw faces we recognized who helped us out. We were in line, got the shot. I mean, everything's smooth. There's been no complications whatsoever with this.
Aaron organized vaccine clinics and found PPE that was impossible to find. He worked closely with Fresno County to be one of the first vaccination sites. The vaccines were made available to our individuals, their families, and CVRC staff. At the beginning, when no masks were available, Aaron found mask-making material and organized 71 volunteers to make the masks. Over 400 masks were made and distributed. Aaron continues to assist and lead us into a new norm. All this was made possible through Cleara's leadership, guidance, and overall support to this team. She reviewed all COVID proposals throughout this year, traveled far and wide to get PPE, worked around the clock to provide support, sat in numerous meetings related to COVID-19, and led us through this pandemic.